health and condition. It brings you joy and peace. A horse allows you to achieve your most desired goals in sports and in life. It helps you forget your worries, pursue your passions, and boost your self-confidence. What will you give in return for its friendship and devotion? Take care of its health. The Pets Diag hair test will allow you to assess the condition of your horse. Skin and hair, muscles, joints, and hooves, immunity, growth and breeding activity. Check their condition and take measures based on our recommendations. Order a test on petsdiag.com and send us a mane hair sample. Remember, your horse.
Hello, everyone. Hello, Camilla. How are you today?
Very well, thanks, Martin. How are you?
Fine, thank you. It's great to have you here today. Give our followers a few minutes more to join to our webinar. As you can see, and maybe you will know that as Pets Diag, we specialize in elemental hair analysis test for horses. I will show you, before I introduce our special guest today, I will show you what you can test using 𝐘𝐸 for horses. So generally we're using horse hair to test the level of micro, macro elements and toxic elements. And according to those levels, we can inform you about condition of different areas of health and well-being your horse, like immune system, stress level, digestive system, metabolic rate, hormone imbalance, etc. So those information you will find in our report. Of course, each part is described in more details. So by the way, you can check the sample report on our website www.petsdiag.com. So feel free to check how it looks like. And of course, for all our today's guests and followers, we have a special discount for our tests. It's 50% with the code webinar. So feel free to use it and take care of health of your friend. Okay, so today's host is our special guest, is Camilla Whishaw, Equine Naturopath, Optim Equine. She's a highly respected and sought after equine naturopathy based in Australia and consulting globally. She's an experienced equestrian and has had an active lifelong involvement in the thoroughbred breeding and racing industry. She's also passionate about solving challenging equine health conditions through holistically evaluating horses and employing targeted dietary, nutraceutical, Western herbal medicine, and management practices. And the topic of today's webinar is nutritional and herbal medicine supplements in horses. Do they actually work? How do you choose a good supplement? And what do we need to be aware of? Camilla, as I mentioned, it's a great honor to have you here. So please start today's webinar.
Thanks very much, Martin. It's a pleasure to be here. We'll just get the slides up. Sorry, bear with me. Right, we're in business. So good morning, good afternoon, or good evening, depending on where you're tuning in from in the world and whether you're watching this live or watching back the replay. So as Martin mentioned, tonight we're going to talk about nutritional and herbal medicine supplements in horses. Do they actually work? How do you choose a good supplement? And what do we need to be aware of? So as we go through this presentation, we will talk about what are natural supplements exactly, how do they work, what are some of the benefits of natural supplements, why is it that they sometimes work, but why is it when other times, why don't they work? how do natural supplements interact with conventional pharmaceutical treatment? So drugs that your vet might prescribe your horse. How might natural supplements conflict with conventional treatment? So again, some of the pharmaceuticals or drugs your vet might prescribe a horse, how can natural supplements interfere with that treatment potentially? And what are some of the risks and cautions we need to be aware of when we're using natural medicines and natural supplements? So we get an understanding, and so we've got somewhere to start. What exactly are natural supplements? Well, they're primarily nutritional supplements, also known as nutraceuticals, which are nutrients. So our vitamins, minerals, amino acids, so the building blocks of proteins, fatty acids. And we also have what are called accessory nutrients. So these are nutrients that are not specifically classified as vitamin or mineral and are not vital for a horse to live and to function, but they're found to promote optimal health. So a couple of good examples of accessory nutrients are things like chondroitin and glucosamine, which are commonly found in joint supplements. Now, our other main class of natural supplements are herbal medicines. And generally, the two most common schools of herbal medicine used in horses are herbs which belong to traditional Chinese medicine and herbs which belong to Western herbal medicine. So we may find these herbs in dried form. So if you think of chamomile, you know, whole chamomile flowers. We may find them in a powdered ground up form, or we may find them in a liquid form. For the purpose of this webinar, I will be referring to Western herbal medicine, in that it's the area I practice in and qualified in. And it's also because our Western herbs most mimic or potentially most mimic and relate to pharmaceutical drugs, so our standard drugs that are used in veterinary medicine. Just to give an understanding of how widely used natural supplements are, research has shown that 80 to 98% of horse owners use natural supplements on their horses. So being nutritional supplements or herbal medicines. And again, this relates to ingestive supplements, so supplements that we feed or orally syringe our horse, not injectable supplements. If we hone in on nutrients, so again, remembering our vitamins, our minerals, our amino acids, and our accessory nutrients, we generally use these to meet specific requirements. So horses, like humans, have a recommended amount of nutrients that they should receive on a daily basis to help prevent disease deficiency states. But there are also times where they have increased nutritional requirements of certain nutrients, and it's generally when a horse is ill, when it's injured, if it's recovering post-surgery, if it's got a wound we're trying to heal, and also horses that are performing at really high levels or in demanding disciplines or intensive training or competition. In terms of herbal medicines, I generally employ these for their pharmacological activity. So in essence, a natural alternative to mimic what some of our drugs do, and in many cases do what there are no drugs for, or what drugs can't. It's a misconception or a false notion that herbs are a good source of nutrients, of vitamins and minerals. There are very, very few herbs that provide significant amounts of vitamins and minerals needed for our horses in doses that actually have an effect on our horses. So I'll never use, or I won't use herbal medicines to try and directly correct a nutritional deficiency or insufficiency in a horse. I will often use them to help improve gastrointestinal health, so reduce inflammation in the gastrointestinal tract and promote cellular repair there, which in turn allows a horse to digest and absorb nutrients we might feed them better. But the herbs in and of themselves aren't a good source of nutrients in most cases. So there are a lot of benefits of natural supplements when they're used correctly and appropriately. So horses need nutrients for all metabolic functions in their body. They need them for growth, for reproduction, for the production of hormones, for immune cell production. They're needed to incorporate into bones, tendons, ligaments, muscles, connective tissue. If we don't give our horses those nutrients, all those metabolic functions are impacted. As I said previously, horses require nutrients for all functions in their body, everything from digestion to immune function to metabolism. Horses, like humans, have nutrient requirements. The nutrient requirements for horses were developed by the National Research Council, and they were last updated in 2007. So this is 16 years ago. We've certainly learnt a lot in terms of horse health and nutrition in those past 16 years, and science has certainly shown us plenty that hasn't been accounted for then. The other thing we need to remember with nutrient requirements are they are baseline nutrient requirements to prevent disease deficiency states in a horse. There's a really stark contrast between a disease deficiency state, so a horse not having enough nutrients to help prevent disease. There's a very big difference between that and between optimal health, performance, reproductive function, and well-being. So although the nutrient requirements give us a baseline to work from, they don't truly necessarily reflect an individual horse's needs. The other thing to remember is these guideline nutrient requirements don't take into account certain medications a horse is on, which a lot can certainly influence nutrient requirements and nutrient status. It doesn't take into account if a horse is sick or injured. If we've got brood mares or stallions, it doesn't take into account their reproductive history. So we need to be aware that these are simple baseline requirements. So we may supplement nutrients to help meet those baseline requirements, but we also may supplement nutrients to address nutritional insufficiencies and deficiencies in the diet. Insufficiencies and deficiencies are when a horse doesn't have enough of a particular nutrient, and these can occur through several different mechanisms. It may be that we're not feeding our horses enough of those particular nutrients. It may be that they have compromised absorption of nutrients. So if a horse doesn't have good gastrointestinal health, if its gastrointestinal tract's quite inflamed, if it's ulcerated, if they have impaired production of digestive enzymes, if they're on ulcer medications. So we know that omeprazole, which is our gold star standard ulcer medication, pharmaceutical medication, and it belongs to a class of drugs called proton pump inhibitors. Our other main ulcer medication is called ranitidine, or the active constituents ranitidine, and it belongs to a class of drugs called histamine receptor antagonists. Those medications, by their very nature, interfere with a horse's ability to properly digest and subsequently absorb and utilize nutrients. And further down the digestive system, it impacts gut microflora, which influences B group vitamin production, biotin production, vitamin K production. So our horse may have compromised ability to digest and absorb nutrients. They may be on medications which promote increased excretion of nutrients. Some drugs, such as corticosteroids, will result in increased excretion or metabolism of nutrients such as magnesium and calcium. And so our horse might not get enough nutrients, they mightn't digest it properly, they might have increased metabolism and excretion of it. They also, in the case of any drug or medication that compromises gut microflora, they'll have impaired synthesis again of those B group vitamins, biotin, vitamin K. Now, whenever our horses are under times where they've got increased stress, which results in increased metabolic rate, increased cycles through Krebs cycle, illness, injury, they're burning through extra nutrients to what they need on a daily basis. And it can be why, from an energy perspective, not a nutrient perspective, but from an energy perspective, why if you've got a horse that had been in hard work but has suddenly got injured and requires surgery or suddenly had an accident, it can be one of the reasons why you can still feed them the same amount of feed they were getting before, although now they're not exercising, and still drop weight. So although in these cases often they'll have increased energy requirement, they'll also have increased vitamin and mineral requirement to facilitate that repair, to counteract that inflammation. When we use natural supplements properly, we can promote healing and recovery. So remember that all cells are needed to promote repair. In the case of injury, if our horse is sick, then we need things like white blood cells, which require nutrients. And again, when a horse is sick or injured, there's an upregulation of the production of those cells, providing there's the nutrition to meet it. And if they don't have the building blocks to help meet that increased requirement, then their healing or recovery is slowed down. Herbal medicines also work beautifully in many cases in healing and recovering, in that we've got so many different beautiful herbs of different classes. So we have anti-inflammatories, which can help reduce inflammation. We have herbs that can help promote blood flow, particularly to tendons, ligaments, and bones. And in the case of tendons and ligaments, they don't normally get a lot of blood flow, so that can be really effective. We've got herbs that can help repair ulceration to the gut lining and inflammation in the gut lining. So again, commonly ulcers, they can be very useful there. We've got herbs and nutrients that help promote the integrity of connective tissue. So whenever we've got a ligament or a bone or a tendon or a muscle tear or damage, for that to heal and repair properly, the collagen fibers need to form what's called a triple helix formation. And certain herbs can help ensure that in the case of ligaments, tendons, muscles, that those fibers align nicely and they have that proper integrity. Many of our herbs and nutrients can mitigate some of the side effects of medications. So if we think of things like non-steroidal anti-inflammatories such as bute, flunixin, banamine, antibiotics, corticosteroids, all those medications can compromise gastrointestinal integrity. So the cells lining the stomach, they can cause damage to them. They can alter blood flow to the digestive system, and they all impact gastrointestinal microflora. So remembering that those healthy microflora in the hind gut synthesize B group vitamins, vitamin K. You'll hear a lot of mention of the digestive system and effects there, and how supplements can affect those things. If you haven't seen the webinar we did last year or the year before, I'm losing track of time, but we've certainly covered digestive health with Pets Diag, and go back and have a look at those webinars, which are on both Pets Diag website and my Optim Equine website. So yeah, some of our herbs and nutrients do a brilliant job in helping mitigate some of the side effects of medications. Some of our herbs and nutrients can help enhance the efficacy of medications. So if our horse needs to go on particular antibiotics or anti-inflammatories, and this is really beneficial in that it can help allow us to reduce the dose of some of those medications and therefore decrease reliance on them and potentially reduce some of the side effects. And it can also help reduce the duration we need to use some medications for. Some herbs and nutrients can also support the way a particular drug works. A really cool example of this is there's a nice bit of research to show that supplemental vitamin A actually improves the efficacy of some antibiotics. And for really stubborn infections, this can be incredibly beneficial. It's also really good in that we need to be really judicious with how we use antibiotics given such high levels of antimicrobial resistance. So they can be brilliant through many mechanisms with that. Having said that, herbal medicines and nutraceuticals can be therapeutics in their own right. So we have a plethora of good research to show that certain nutrients and certain herbs um, in certain situations can replace the need for medications, which can be really good in that it's a natural alternative. There's a far less risk of side effects, again, when supplements are used appropriately. Um, and in cases where we need to be really careful about medication use, particularly antibiotics and something like that, it's a great alternative. One thing I don't think we probably discuss enough is using natural supplements can make us feel like we're doing something positive. I think it's fair to say that everyone tuning in to the webinar tonight and anyone watching really loves and cares about their horses. Whether you're a vet who's treating horses or whether you're an owner or rider, we work and associate with horses because we love them and we genuinely care about them. It can be really distressing when a horse is suffering or has an illness or injury and we don't feel like we can do a whole heap. Yet sometimes using supplements or giving our horse something makes us feel like we're doing something beneficial for our horse, and therefore we feel better about ourselves. Um, but probably a good example of that is, say, a horse has a viral infection, a mild viral infection, respiratory tract infection, nothing too bad, nothing that's going to harm it, but it needs to run its course. Now, often people will call upon a vet in that situation, and there's very little that conventional pharmaceuticals can potentially do in that situation. If the horse has got a fever, then they may go on an anti-inflammatory to help bring the fever down. But commonly in situations like that, a horse is prescribed antibiotics in that the vet feels like they need to do something for the owner, for the horse. Now, we know antibiotics are not indicated in viral infections. They're indicated in bacterial infections, but not viral infections. Yet, if we look at natural supplements, there are certainly particular nutrients that can help with immune function during that time. We've got nutrients and herbs that are mucolytics. So, if a horse is snotty, can help break and thin that snot or mucus. And we can avoid the unnecessary use or inappropriate use of medications in an instance like that while helping the horse's recovery. There's no denying that the more time goes on, the more demand there is for a natural alternative. People want a natural alternative to help their horse. Another benefit of natural supplements is that they can provide a treatment option where there's no conventional veterinary or pharmaceutical treatment. So a good example of this, I do quite a lot of work in the field of stallion fertility. There's very little that can be done from a pharmacological perspective, particularly keeping a stallion's long-term health and fertility in tip-top shape. There's very little that can be done if a stallion has low testosterone levels or low sperm count or poor sperm motility or morphology. Yet there are some brilliant herbs and nutrients that can help with those specific fertility parameters. Another instance which would fill a few of those points is if you think you've got a horse that's injured, that's on box rest, that's really starting to get cranky and temperamental. You don't want to constantly be sedating that horse, but you may want to take the edge off that horse while supporting its healing and recovery. And again, there are some beautiful herbal sedatives, herbal hypnotics, herbal relaxants, which can be, certainly won't knock your horse out like a pharmaceutical sedative, but can just take that edge off the horse and help them be more calm and relaxed during their recovery period. And obviously that's beneficial from so many levels in that reducing that cortisol will aid in their healing. But if a horse is calmer, they're less likely to hurt themselves while we're trying to help them heal. So we've talked about the potential benefits of natural medicines. in natural supplements, so herbal medicines and nutraceuticals. But like a lot of things in life, there's a flip side. So there's definitely some negatives that we need to be really, really aware of. In many parts of the world, Australia included, there's a lack of regulation around the production, around the labeling, around the marketing and claims that can be made through about natural supplements. So, in Australia, for example, we have a body called the Australian Pesticides and Veterinary Medicines Authority, who oversee the production of veterinary goods. Some nutritional products will be produced under these regulations, but it's not compulsory for them to, unlike veterinary medicines, which have to be. Which means that there's a lot of products which are targeted at the horse market where there's no third-party testing and there's no quality control over what goes into a product. So manufacturers can make really bold claims about a product that doesn't have to be substantiated. They can also make claims in marketing, which can be misleading. And they also don't have to label what's in a product. So some companies will label what's in a product. That doesn't guarantee that what they've put on the label is actually contained in the product. And that doesn't guarantee that there are not things in that product that are on the label. So we really need to be aware that with a lot of nutritional supplements, we can't be 100% confident that we're giving what we think we're giving. On that too, herbal medicines or herbal products can really fall badly in that category. For that reason, as a practitioner, I only ever use herbs which are produced under the Therapeutic Goods Administration in Australia, called the TGA. For herbs to be TGA registered, they have to undergo batch testing, they undergo third-party testing, and they have to meet strict criteria. As for someone to be able to access and prescribe TGA goods, they must be fully qualified, they must be registered with the TGA, they must be registered with professional association bodies, and they must undergo continuing practitioner education. So if you're buying something off the shelf, you are not buying a good that falls under TGA regulations in terms of herbal medicines or herbal products in Australia. On that too, things that are liquid herbs that are sold online, you need to be really, really careful in that our TGA rules for practitioners are that you can only ever prescribe herbal medicines after doing a consultation. So if you're finding liquid herbal products that claim to be TGA goods, either that whoever's supplying them, the practitioner, is practicing illegally in that they're not doing a consultation if they're available off the shelf or online. They're not a TGA registered practitioner and they're sourcing their goods from elsewhere, which is a cause for concern, or they're making false claims in that they're not TGA registered goods. So something to be really aware of. And one of the many reasons I only ever use TGA registered goods is so I know exactly what's in the product. I know how much of the active constituents in the product, and I know exactly what I'm giving a horse and how effective it should be. If we go back to products in general, the advice we're given about natural supplements can be really, really biased. So in terms of vets in Australia particularly, but I think it's reflected largely around the world, they do very little study on equine nutrition within their veterinary modules, let alone supplements, herbal medicines, nutraceuticals. If a vet is really well versed and qualified in those areas, it's because they've gone and done additional study and additional training. But with the stress and the time constraints most vets are under, that's really rare. If they go down that path, they generally just specialise in nutrition, in that nutrition is a practice and a therapeutic and a profession in and of itself. So most of our advice comes from the companies who produce the products. They're not going to tell you any limitations of their products. They're only going to tell you the good things. And again, if we go back to the lack of regulation, they can effectively tell us what they want in many cases. Sometimes too, in different areas, vets or other practitioners are sponsored or supported by particular brands, and will often have brand reps visit them and provide them with direct information. In these cases, again, they're getting their information directly from the supplier or the provider. So we need to be aware that advice can be really biased and we don't often get the full picture. And sometimes, as owners or breeders or riders, it can be really hard to know which questions to ask about different products. And at the end of the day, most times when we're looking to supplement, our horse has got a health or a behavioural problem or it's got an injury. We're under increased stress and we're quite vulnerable, and we want to do whatever is best for our horse. So in many cases, owners will give many things a try. So just be really aware that advice can be biased. We need to be aware that in some cases, there's a lack of research into the products produced. Sometimes where there is research, that research can be of really poor quality. It can be a small sample size. It can be non-blinded. In many cases, that research is done in-house. So, of course, the company is going to make the claims and research favourable. They're not going to produce a product with research that, if they've done research, that doesn't support it. And in many cases, we need to question just how effective the supplements are. In both nutritional and herbal supplements, but far more likely herbal supplements, we can have issues with purity of the supplement or what we call adulteration. So where other species of a particular herb or other substances are added to a product, whether it's liquid or powdered. Some really good examples of this are turmeric. So there's been some research to show that a lot of turmeric on the market, and again, many people like to use turmeric, horses with osteoarthritis or inflammation or for gut health. There's been plenty of research to show that a lot of turmeric products on the market actually contain chalk and lead and different colouring agents. Certainly things we don't want to be feeding our horses. If we look at another herb, something like Panax ginseng, also known as Korean ginseng, which can be a brilliant herb when applied appropriately, it's a really, really, really expensive herb to buy in its pure form. On the market, on the internet, in products, it's often substituted with different species of ginseng. So we need to be aware of those things. Depending on what discipline you're competing in or riding under or racing in. If a horse is a competition horse, the use of some herbs isn't permissible. So under FEI rules or different racing jurisdictions. So we need to be aware of that. And we particularly need to be aware of that if we don't know what's contained in a herb. In terms of herbs and nutrients, we refer to what's called bioavailability. So this is the ability of a horse to digest, absorb, metabolize, and utilize what we're giving it. Now, if we look at different nutrients, particularly minerals, but also vitamins too, minerals and vitamins are bound to other molecules to make a compound. So, for example, if we look at magnesium, magnesium comes in a lot of different forms. We can have magnesium chelate, magnesium citrate, magnesium chloride, magnesium oxide, magnesium sulfate, magnesium bisglycinate, magnesium malate, magnesium orotate, depending on what that magnesium is bound to. Now, depending on which one of those you use, is significantly going to influence its bioavailability, so how well our horse can digest, absorb, and utilize it. For the majority of nutrients, not all of them, but for the majority of them, those with poorer bioavailability are much cheaper and they will often yield a higher amount of that nutrient on paper, which means most supplement companies will tend to use nutrients of poorer bioavailability, in that there's going to be a bigger profit margin. So it's something to be aware of. So just because we're giving a horse a dose of something doesn't mean they can necessarily utilize it all, or even utilize a good part of it. If we don't use an appropriate dosage amount, we can run into troubles with our horses. If we use too little of something, it's unlikely to have much of an effect. If we use too much of a herb or a nutrient, it can have toxic effects, or it can cause side effects and consequences. On that one, an interesting one where there's been a little bit of research done in horses is the use of tryptophan. So it's an amino acid which is used to help produce serotonin, which is a nice calming neurotransmitter. Now, the research has shown that it is the response to tryptophan supplementation is species dependent, so it can work really well in other animals and it can work well in humans. But the research that's been done in horses shows that small amounts of tryptophan actually cause mild excitement in our horses. And again, tryptophan's contained in some carminative or calming supplements for horses. It can actually make them more excitable, which isn't what you want. On the other end of the spectrum, high doses actually reduce endurance capacity and could cause hemolytic anemia, so the breakdown of red blood cells. You don't want either of those responses. So getting the dosage amount is really crucial. And if a horse is on particular medications, that can significantly influence the dosage amount that's appropriate, whether it's herbs or nutrients or both that you're looking at. Some of our nutrients need what we call cofactors, so other nutrients that join the party to help those nutrients work effectively. If we go back to the tryptophan example, we know that for tryptophan to end up as serotonin, so that nice calming neurotransmitter, it needs sufficient amounts of magnesium, iron, calcium, B1, B3, B6, B9, zinc, adequate supply or production of in horses of vitamin C. Without adequate cofactors in appropriate amounts, the ability of a nutrient to do what we want it to do is compromised. It's a really common misconception that just because something is natural means it's safe. And this is not always the case. And there are certainly plenty of examples when it's not. So just because something's natural, don't automatically assume it's safe. Whether that's because of purity reasons, as we've talked about earlier, whether that's because a supplement contains things that aren't listed on the label, or it doesn't have a label, or it doesn't contain what it says it contains, or whether it's just that that supplement is used inappropriately. So particularly there are some herbs that I would never use in a pregnant mare or a lactating mare. Another common supplement that's used a lot, particularly in racing horses and sometimes other performance horses, endurance horses, is iron. Now, the vast majority of horses don't need iron supplementation. And excess iron actually sets up inflammation in the body and enhances inflammation. If a horse has an infection, whether that's bacterial or viral, those infective microbes actually need iron to reproduce. So if a horse has got an infection and we're giving it more iron and it doesn't need that, then we can prolong and increase the severity of that infection. So again, although iron can seem like a natural, or it is a natural supplement, it doesn't mean it's necessarily safe. We also need to be aware that herbs and drugs and nutrients interact. We can have herb-herb interactions, we can have herb-drug interactions, we can have herb-nutrient interactions. We can have any combination of those three. As we talked about a little earlier, there are some interactions which are really beneficial, which can help improve the efficacy of the other herb or drug or nutrient we're using. But there's also some that we certainly don't want interacting. There are some herbs, more so herbs than nutrients, but nutrients can too, that will upregulate certain metabolic processes, which can increase drug clearance. So it might mean that a horse on a medication, you put on a particular herb and it processes and metabolizes that medication quickly, which means that that medication leaves the system quickly, which in many cases you don't want to have that happen. So just being aware of that. In terms of nutritional supplements, if we're already feeding our horse a fortified feed in appropriate amounts, and then we go and add a calming supplement with a few B group vitamins and a bit of magnesium, and then we add a bit more magnesium because we think that will calm our horse, and then we go and add a hoof supplement, which has got zinc and other things in it, we can end up overdosing quite severely on nutrients. We can cause imbalances between different minerals. So different minerals should be given in certain ratios to help promote optimal health. The other thing we need to be aware of is that some nutrients compete for the same receptor sites to be absorbed, meaning if we give too much of one, then it will inhibit the absorption of other nutrients. Good examples of this include our divalent minerals, so magnesium, calcium, zinc and iron. So if we go really high dose or prolonged higher dose in one of those nutrients, then we can offset and inhibit the uptake of those other nutrients. Another potential negative of natural supplements is poor understanding and application of a herb or herbs and nutrients. So how do you or an owner or a vet know how to choose a quality and effective supplement? And how do you work out exactly what's appropriate for that horse? The other thing is, does the supplement you're using actually address the cause of what's wrong with the horse? Again, that's going to take a thorough case history, analysis of a horse's diet, going through any medications it's on. But it's one of the many reasons why if a supplement doesn't work, it's because it's not addressing the underlying pathophysiology or what's going on for that horse. So if we choose appropriate supplements and we prescribe them correctly, a summary of this is going to be a summary. Sorry, I should flick through. This is a summary of the roles they can play. So again, they can address nutritional deficiencies or insufficiencies, whether that's because a horse isn't getting enough of those nutrients in its diet, or it has upregulated metabolism or upregulated excretion of those nutrients, or drug interactions which are causing those nutritional deficiencies or insufficiencies. Both herbs and nutrients are able to modulate specific biological pathways. Really important whenever we've got immune system involvement, whether we've got inflammation, when we want to alter neurotransmitters, so chemicals which influence a horse's mood and temperament and behaviour. When applied appropriately, they can enhance pharmaceutical efficacy, so improving how a conventional drug works in a horse. We can mitigate some of those pharmaceutical side effects in many cases. We can facilitate enzymatic processes. So any biological process in a horse requires enzymes to work. We've got plenty of illnesses in horses which are influenced by nutrition. Equine metabolic syndrome, laminitis, gastric ulceration. By appropriately using nutritional supplements and addressing nutrition too, we can potentially reduce pharmaceutical reliance. And if we think of things like juvenile joint disease in our horses, or orthopedic diseases, maldevelopment, cysts, lesions, through proper nutrition, we can definitely reduce surgical intervention down the track. And again, to correct dietary insufficiencies and deficiencies in a pregnant mare, in a lactating mare, in weanlings and yearlings, can certainly set bone and joint health and development up a lot better down the track. This is something you see quite a bit in thoroughbreds and warm bloods, so something to be aware of. Many of our herbs and nutrients can help heal and repair beyond what many medications can. So, in many instances, medications can help to provide pain relief um, and symptomatic relief. But in cases of injury, oral supplements or oral medications are rarely able to help tendons, ligaments heal significantly, things like that. We can also, when we use our natural supplements correctly, help to address the cause or causes um, of the illness or injury in the horse and not just provide a band aid effect. So, not just cover it over, which is really important for our horses' health and well-being and longevity. So, for effective prescribing, some key considerations we need to keep in mind. Again, the dosage amount, so how much of that actual herb or nutrient we're giving, the bioavailability of the form we're giving, so making sure we use a form that's highly bioavailable. We also need to be aware of what are called excipients. So these are things that are often added to products as fillers or anti-caking agents, things that are commonly found in powders. So we might buy a powder of a particular supplement, for instance, a calming supplement. 90% of that, for example, could be milk powder or glucose powder or some other filler and have very little of the actual active ingredients we think we're getting. Which leads into the next question, really being very strict on how we assess quality of products. Remember that particular nutrients are going to need cofactors, so partners in action, to help them actually do the job we want them to do. We need to be aware of inhibiting factors, so things that will stop a horse being able to properly utilize those herbs and nutrients. Some of our common inhibiting factors include our gastric ulcer medications, particularly in the case of our minerals. They interfere with their digestion and absorption. Particular heavy metals, so aluminium, lead, cadmium, will inhibit the uptake of particular minerals. Again, they will block receptor sites. So we need to be aware of things which may result in a herb or nutrient not being properly digested and absorbed, and or increase the requirements of that herb and nutrient. We need to be aware of indications, so what information we're getting from the horse in front of us, its health history, the medications it's on or has been on, the supplements it's on or has been on, the diet that it's been receiving. What information are we gathering from that horse that tells us that these are the key herbs or nutrients that horse needs at that point in time? On the flip side, we need to be aware of contraindications. So there are particular herbs and medicines that should never be given together. There are times where we shouldn't use particular nutrients, such as the iron example. There are definitely herbs that are not appropriate in pregnancy and lactation. We need to be aware of interactions, so positive and negative interactions. Whenever I prescribe a herb or nutrient, in my mind, I've got at least a rough, if not a really clear timeline of how long I'm going to use that herb or nutrient for in that horse in front of me. Now, as the case progresses, that time frame may change, but it rarely changes significantly. Essentially, if we give a horse a herb or nutrient, in my eyes, it's not good practice to give a herb or nutrient with no pre-thought time where we'll go, okay, we'll review its use. Very rarely, in my opinion, should a horse be on a particular herb or nutrient for life. Obviously, there are exceptions, things like an older horse with osteoarthritis or a horse with osteoarthritis. If we're using accessory nutrients to get the beneficial effect of them, that horse is going to need to remain on them long term. If a horse has PPID, then again, particular herbs that I use in a horse, similar to the use of pergolide, if the horse goes down that track, is going to need to be on that for the rest of its life, essentially. But in many cases, if we're aiming for recovery from illness or injury, if we're helping a horse overcome infection, if we're helping to modulate neurotransmitter production, so if we've got a horse that's anxious or cranky, or has been in pain, we want to have a timeline for when we come off those herbs and nutrients. To be honest, it's probably more concerning long-term use of, as a general guideline, long-term use of nutrients as opposed to herbs, in that, particularly with our divalent minerals, but through all our minerals, we can cause severe imbalances in different minerals, which impacts a horse's overall health long-term. So if you're self-prescribing or your horse has been prescribed something, please, please, please keep in mind a timeline, whether you've found good results or not with the product. It's really important. Whenever I supplement a herb or nutrient or combination of herbs and nutrients for a horse, must have a clear purpose for its use. There's very little value in just throwing supplements at a horse willy-nilly without having and knowing why we're doing something and what we want to achieve and how we're going to achieve that in our horse. Oral supplements are only as good as a horse's digestive system. So if a horse has really compromised digestion, then its ability to utilize what we're giving it is going to be compromised. And I think it's fair to say that regardless of what I see a horse for initially, 99.9% of those horses, at least some of their treatment will be geared to restoring good gastrointestinal health. Because without that, if they can't properly digest, absorb, metabolize the nutrients and herbs we give them, then they're of really limited value. And again, if you haven't seen those previous digestive health webinars and also webinars, jump on and have a look. Or even if you have and you want a refresher, go back and have a look. So on that, what makes for successful prescribing? What makes for appropriate use of herbs and nutrients in our horse? Firstly, we want to address the identified causes of our horse's health issue. In most horse health complaints, whether they be illness, whether they be poor fertility, whether they be injury, whether they be behavioural issues, they're generally multi-layered and multifaceted. We all want a quick fix in life, a simple fix in life. It would be really nice if there was just one clear causative factor. Some cases there is, but in most cases, it's a combination of factors. There can be underlying pathophysiology, there can be suboptimal feeding practices, there can be medication practices, management practices, a lot of things that have fed into that picture. And until we properly identify what's contributing to the health issue and properly address it, you're never going to get the full way to successfully resolving the case. Or you may feel like you kind of get somewhere with a horse's health issue and then it reverts back or recedes. So we need to clearly identify and address the causes of the health issues. As I said earlier, any supplement or herb I give has to serve a clear purpose. So whenever I take a case history of a horse, doing a consultation on a horse, an assessment, as I'm getting an understanding of the causes or the contributing factors to their health or illness or injury issue, behavioural issue, fertility issue, in my mind, I've got clear treatment aims of how I'm going to address that. Every single herb or nutrient I prescribe, every dietary change or management change I recommend must meet at least one of those treatment aims. And the majority of herbs and nutrients I use meet multiple of those treatment aims. If I can't justify how a particular herb or nutrient is going to help a horse, then I don't prescribe it. Prescribe to the individual horse in front of you. So it can be really common to go, well, this horse has got this condition, osteoarthritis, laminitis, gastric ulcers. So we do X, Y, and Z for this horse. Now, although there will be supplement overlap, similarities in supplementation, similarities in key management practices, at the end of the day, to be really successful in prescribing and treating a horse, you need to look at the horse in front of you and tailor its treatment plan to that horse and what's going on for it and its environment and what has led to its health condition or illness or injury or behavioural condition in the first place. In many horses, particularly when they've got a complex health history, when they've got several different disease pathologies or things going on at once, you're going to have a lot of treatment aids with those horses as you're going through in your head everything that's happening. For those horses, you really need to prioritize order of your treatment aids. Some you want to go and do initially, some you will want to wait until you've initially restored good gastrointestinal health and good baseline health before you go and throw other supplements at it. Otherwise, you can just make an expensive mess for yourself and not really achieve a whole heap. Ensure that anything you prescribe is prescribed alongside sound dietary practices. So things like the benefits of fiber for chewing and what that does for the gastrointestinal environment, stomach health, preventing gut ulcers, maintaining pH throughout the digestive tract, stimulating the production of digestive enzymes, helping support healthy gut microflora, producing B group vitamins and biotin and vitamin K. We can't out-supplement that long term. We need to prescribe supplements alongside good dietary practices. Whenever we use supplements, whether they be herbal medicines, whether they be nutraceuticals, we need to ensure that they're really good quality, that we're using a therapeutic dose amount, so an amount that will have an effect for that horse, given its health condition, given its health history, and given any medications it may be on, given it the workload it's under. Have a clear time frame for how long you're going to employ that treatment and how you're going to assess if that time frame is effective, or if you need to extend the duration at all, or if you need to shorten the duration. Be really aware of any interactions anything you're prescribing can have. And probably one of the most important things is we can't out-supplement a bad diet. We can't out-supplement underwork of a horse or poor education. We can't out-supplement poor training. And we can't out-supplement a rider mismatch or a handler mismatch. So in summary, putting this into practice, identify and address your causes, which are going to help determine what nutrients and herbs are appropriate. Get those sound dietary basics right. On that too, and something I probably I don't think I mentioned earlier, is for baseline health, our horses need a minimum of 1.5 to 2% of their body weight in dry matter daily. So dry matter fiber being that primarily found in hay, lucerne hay. Certainly those are forms of long stem fiber. We still get dry matter in things like beet pulp products and chaff, although that's short stem fiber. That's a building block or foundational basis of our horses' diets. We do know, however, that if we want optimal health in our horse, as well as preventing disease deficiency states, the way we farm and the way our pastures are worldwide, our horses will not meet all their key mineral requirements, and in some instances their vitamin requirements, on a forage based diet alone. So whether that be hay and grass, or grass, if we're relying on that to provide all the nutrients for our horses, they're going to have nutritional insufficiencies and deficiencies. Remember, we can't out-supplement a bad diet or underwork or poor training or rider mismatch. Remember, a lot of supplements have dubious quality. Certainly there are brilliant supplements out there, and I use them, and others use them too. But remember that a lot of supplements have dubious quality, and probably be more skeptical of any supplement than believing every claim that's made. Remember that companies use clever marketing. They're in the business to sell supplements. They're not going to tell you the shortcomings of their supplements. So keep that in mind. Something that's really important to be aware of, particularly in behavioural issues, that supplements can lead to a placebo effect, definitely. There's research to show that when our heart rate goes down and when our cortisol levels go down as humans, if we're around a horse, their heart rate goes down, their cortisol levels go down. So if we've had a horse that's been challenging, flighty, spooking, shying, nervous, chances are we're going to be doing that too. We're feeling that too, even if we think we're a calm, grounded person. And we're starting to expect that behavior. Now, if we feed it some calming supplement, we don't know any better. We think it's a good product, good marketing behind it. Yet in reality, that supplement actually doesn't contain anything that's really effective to directly help our horse to calm down. The fact that we think it might work, our cortisol levels drop, our stress levels drop, our horse's cortisol levels and heart rate levels and stress levels drop. So the placebo effect does occur with us. It can be really hard to be aware of it or to be able to judge it, but just know that it does happen and can happen. So you could be using a supplement that is really nothing but glucose powder as a calming supplement. I think it's the bee's knees, where the effect is becoming because we're calmer in ourselves. And when we use supplements, be really strategic in how we use them. Don't just take a throw everything at the wall effect, which comes back to understanding the case and what's happening for that horse. And remember that good gastrointestinal health is absolutely crucial. Our horses can only utilize what they can digest and absorb. So that brings us to the end. If anyone's got any general questions, feel free to throw them in the chat box. Otherwise, you're always more than welcome to contact me. My email address is on the screen there. You can also visit Optim Equine online, so www.optimequine.com. And you can also follow Optim Equine on Facebook and Instagram, where a lot of these things are up there and information there which might help guide you. So thank you very much. So I've just got a few comments and questions here. Hello back to Poland. Thank you very much. Thanks very much, Tash. Do liquid herbs usually have less fillers in them? Great question, Cody. Or are they often filled with liquid fillers too? So a lot of liquid herbs on the market are actually diluted with apple cider vinegar. Plenty are diluted with water. Some are even mixed with molasses. Now, in terms of the ones I use, so human grade practitioner TGA registered goods, they're actually extracted in alcohol. So ethanol, which is a solvent which helps get those active constituents. Ones that are available on the market to the public are generally full of a lot of fillers. Pure herbs, pure ethanol extracted herbs are really expensive too. So do liquid herbs normally have less fillers than dried herbs? Sometimes dried herbs, particularly cheaper dried herbs, will have less fillers. Something like chamomile or mint or devil's claw, some herbs like that are generally, not always, but generally not adulterated. So you'll get the herb you think you're getting in the dried form. The only thing is it takes a lot, and I mean a lot, of a dried herb to have a therapeutic effect. So again, going back to the liquids I use, the ethanol extracted liquids, they're really concentrated. Part of the solvent method, so using that alcohol or ethanol helps to draw out those active constituents. When we've got bulk herbs, there's not much of that active constituent. Maybe a way to compare is thinking about orange juice. So your dried herbs might be like an orange. To get a glass of orange juice takes like 4, 5, sometimes 6 oranges. So it's much, much more concentrated. So the amount of the actual active constituents you get in dried herbs is far less, which means it takes far, far, far more to actually get a therapeutic effect. There are some herbs which are an exception to this, but they are generally herbs which are used for their mucilaginous quality, so their ability to absorb water and help promote a soothing effect, something like psyllium or slippery elm bark. But your liquid herbs are going to be far more concentrated if they're practitioner-only ones. The other type of herbs that on the market that are widely available in many cases in liquid herbs are what are called glycetracts. So glycerine is used as the liquid solvent. Glycerine doesn't extract the majority of active constituents. So again, you're not getting a therapeutic product. Great question, Cody. Thank you. Aston, are there any herbs that can help native ponies and their insulin levels? Yes, there certainly are. Again, you want to look at it at a case-by-case basis. And you want to look at what else is going on for that pony. Generally, I'm thinking, native pony living on pasture or being fed a diet that's promoting high insulin levels when a pony isn't designed to be living in those sort of areas. I'm thinking of somewhere like Kentucky, Kentucky bluegrass, with a lot of fat ponies there. Yeah, there are definitely herbs, and I prescribe them on a case-by-case basis. And again, I would only ever use liquid herbs, in that you won't get a therapeutic effect for dried herbs for those ponies. There are also some really good nutrients to use in those instances too. And certainly any other health concerns, if that pony's had laminitis, if it has or is older or is at risk of PPID, they will influence the herbs I use in those cases too. Gabriella, thank you very much. Aston, thank you very much again. You're in the UK. Oh, you make your own teachers. Nice work. Good work. Thank you, Camilla. And thank you, Ewa. And thank you, Cody. No. Someone's typing. I was about to finish. No, it stopped. But yeah, feel free to reach out, and thank you all so much for joining tonight, and we hope to see you at the next one, or today or this morning, whatever time it is, wherever you're tuning in from. So thanks all very much.
Hi, Camilla. Hi, everyone. Thank you, Camilla, for your presentation, for great information you gave us. And we have a little surprise for our participants. Yes, we have a discount code for test for horses. So you will be redirected for the website where you can buy our test. Thank you so much for your participation, and see you again at the next webinars. Thank you, Camilla, one more time.
My pleasure. Take care, everyone.
Thank you.